Today we're going to talk about your dog's hips. We're going to talk about signs that there might be a hip issue and ways that you can test your dog's hips at home. Hi, I'm Tanya Costa, so let's just dive in. Our goal for today is to check for hip dysplasia versus osteoarthritis versus a common muscle injury and lastly, a neurological condition. So let's talk about range of motion. Range of motion will tell you if perhaps there might be some osteoarthritis in the joint. So first, let's look at what the hip joint is. So this is a good hip joint. It's got this ball and it fits in this little socket here. And basically what we're testing for range of motion is doing this and doing this. The hip joint is located up here. And if you feel up here, there's like a little nubble there. So that's your dog's hip. And there's a lot of muscles that cross over the hip joint. So some of the signs that your dog may have some osteoarthritis or something going on in the actual joint is they may have a stiffer gait, or they may not want to jump into the car onto the couch, as well as you may find that it gets worse after heavy exercise. These can be signs. It can be other signs as well, which we'll go over, but those can be some of the signs. So what we're going to do is we're going to take, and this is a really important tip, is you want to put your hands on their lower back area. You'll feel two little raised bits right here, and that's his pelvis. And the reason I put my hand here is if I extend the hip far and they react, we're actually getting some extension and flexion of the spine. And we don't want to be confused that the pain or discomfort is coming from the spine. So if I stabilize his spine and we just hold our hand underneath the knee, and and this is really, really critical, is you need to go very slowly and bring the hip back. So basically this hip joint is right there, and we're just going to bring it back slowly. Now you can see if they do that, which is bringing the leg quickly back, it might be because you're going too fast, because I have found over the years that the hip is one of the most unforgiving joints, and one of the joints that dogs, if you go too far or too fast, they don't like you going there again. So again, we're just going to take our hand and gently extend the hip. And then what we're going to do now, if your dog does that, it may mean that you've gone too far, but we don't know yet if it's a hip issue or a muscle issue. So we're going to get to that. And so I'm going to do that again, and then I'm going to flex the joint up towards his belly and then come back again this way. And if you feel like you're doing it and you hit this point where there's resistance, i.e. the dog is trying to protect using its muscles from you pulling it back, respect that. Don't go farther than that, because he's telling you something. So that's how you assess range of motion. And you always want to do both sides, because you want to see, is one side better than the other? And you can see here, I can actually go further. So now I'm starting to think, okay, is something going on the right side? Because you can see he's not, he's letting me go all the way back, much further than on the other side. I always seem to find things with my own dogs. It's like the shoemaker's son. If your dog has some osteoarthritis, if we look at this bone model here, we can see this surface here is not very smooth like this surface. And what this is telling us is that there's degradation of the bone, and the reason they're getting pain and inflammation is because there's some bony rough bits, for lack of a better word, touching some other bits. And sometimes, even with the x-ray, you can't really tell functionally how your dog is doing, because if it's not touching any bits that hurt, then they may not be that painful. Another common thing that I see in senior dogs, well, active dogs, any dog, but I do see it a lot in senior dogs, it's called the iliopsoas. It's a few muscles that come together. Basically, it can start all the way up here, and it comes along and then comes underneath and inserts right up in their groin area. So let's see if we can do that. right up in here. Now, a word of caution here. I'm going to show you how to assess it, but there is their femoral artery there, which if you put your finger on it, you'll feel some pulsing, and you do not want to be poking around with that. Signs are very similar to a dog with osteoarthritis, i.e., they will have a stiff gait. They may not want to jump up on the furniture or into the car. And most importantly, you see it more, they've been lying down for a while and then they get up and they seem kind of limpy maybe, or very stiff getting up. And then the more they move around, it seems to improve. It's very common for this to occur after heavy exercise or running and slipping on ice or slipping on wet grass or whatever, a slippery surface in your house, because it's that sideways motion, which is not a usual motion in dogs. We think of dogs going forward and back and not this way. So how we're going to assess the iliopsoas, so we can lift up the leg, and right here, like he's a male, so he's got his plumbing is there, and it's right in here. Now, again, a word of caution. If it is sore, your dog will react. So you need to go very slow and look for subtle signs. And what I mean by subtle signs is often when you get close to it, if you're doing it, let's say on his left side, his left ear may start to kind of come this way. And then if you go a little harder, they may start to turn their head. If you go too fast, they might reel around. So you may want to have somebody with you to hold your dog's collar, which is what I get owners to do in my office, because I see, I don't know, probably 5 a week, but just hold their head so that if by accident you go a little too quickly, you don't hurt them. What you're going to do is use this finger, and there's this little flap right here. So we're going to come underneath. And again, if you feel a pulse, then you're in the wrong spot. And I'm just going to lift up gently like this. And he's fine. He's like looking okay. I'm thinking he might actually have, his right groin might be sore. Ooh. So that's a little bit of a sign. But the other thing you might feel is you're running your hands here. And I mean, I've been doing this for so long, my hands tell me everything. But if you run your hands along and you just sort of not pressing too hard, feel the tissue underneath your fingers. And what you may find is when you kind of go a little bit side to side, you may get some muscle quivers. And if you look at my other video here on how to do myofascial release, it talks a lot about how to deal with that. You may be able to find little differences from side to side. And remember, next week I'm going to be showing you how to deal with some of these things. It might end up being 2 videos because it's a lot of information. So the last test we're going to do is neurological in nature. This is not a run to your vet and something's wrong kind of test, but so often when we see our senior dogs, some of the signs that we may see is our dog is tripping, going up the stairs, or wearing of the nails. These 2 middle nails is also a sign. They won't want to jump up on the couch. They may not want to get on the bed or in the car anymore. And again, this is, why so many hip issues can be so involved that we need to sort of come from different angles and see where it's actually coming from. And I do see a lot of senior dogs that have been referred to me for hip dysplasia or hip osteoarthritis with no x-rays. Then I check this that I'm just about to show you, and I say, it's a bit what I call senior dog neuropathy. And senior dog neuropathy is we as humans and dogs, as we age, our nerves don't fire the way they used to. And so we have some deficits in our proprioception, which if you look at this video, it's all about exercises for hind end weakness. And it's not painful because it's neurological and it's not a disc issue. It's just our nerves are not transmitting the information as quickly to the feet to tell us where our feet are, so we trip. So what you may see with your dog or notice with your dog is their center of gravity. So you may see them They're more like this when they're walking as opposed to out here. And the reason for that is they're using their forelegs as sort of like a base to keep balance, because the proprioception or the nerves are just not firing the way they used to when they were younger. So the test for this is very simple. And what you're going to do is you're going to take your dog and you're just going to have your hand under here, just not lifting, just having it there just in case they fall. And basically you're going to take their foot and you're going to turn over their foot. And you see, I can't do it with him because he just quickly turns his foot over. And I'm sure if you've been to your vet, they will do this test. And basically what will happen is if your dog has a delay, it looks something like this, and it will stay like that maybe for a second. Sometimes they won't move it back if it's a little bit more degenerated, but they will keep their foot like that, or it'll take 1 or 2 seconds for them to flip it. It's kind of like their brain says, oh, my foot's turned over. Okay, I got to put it back. So that's a neurological thing that can happen. And it's not really coming from the hip, but it often looks like it's coming from the hip because they have some of the similar symptoms as a dog that may have osteoarthritis or an iliopsoas issue. So I hope that's helpful, and we'll see you next week with solutions to these problems.